For the first time last year, Governor Charlie Baker's administration launched a Latino Advisory Commission. The group was tasked with addressing concerns of the Massachusetts Latino community and promoting economic prosperity and well-being. After a year of community meetings held across the state and discussion among its members, the commission has released 3 priorities it plans to tackle in the next 2 years. Samalid Hogan and Dr. Sonia Pope are among the commission's members, and they sat down with me in the studio to discuss the commission's work.
When I received a phone call to be a member of the Latino Advisory Commission, I got very excited. I have been a Latina working woman in Massachusetts for the past 34 years now. Very involved in my community, very involved in what is happening, and giving the opportunity to students, as I am a school principal, in regards to how to reach out to curriculum, to navigating the school systems, to all that. So I felt that it was a great opportunity for me to continue to give some contributions to the Commonwealth. And so I appreciate Governor Baker creating this commission. I think that he has the best interest in what is happening with our Latino communities, and he wants to help and he wants to be a part of the challenges and aspirations of our Latino communities.
And the commission was brought together about a year ago, charged with coming up with, in the first 2 years, 3 things really that it could tackle. And among those priorities that was recently announced was improve the educational performance and pathways for success for Latino students. What did you think when the commission arrived at that?
One of the big elements was to improve the K-12 system. And I completely agree with the comments that we had in the different 6 listening sessions.
You traveled around the state and held these listening
absolutely.
sessions.
And so this was a big component. Everyone wanted to improve the K-12 program and always the path to college for Latino students as well. So those 2 big components were a good sense of the concerns and aspirations that community members had. And so one of the big elements, for example, were the ELL students in our school systems, in our districts, in our Commonwealth.
English language learners, for
English
those
language
keeping track at
learners.
home. Yeah.
Yes. So we worked very hard at listening to the concerns and the aspirations of where people wanted to see the students at that level. And so that was a major component to that we work at to ensure that every concern was listened to.
And workforce is really your area of expertise, and that was also one of the priorities that ended up on the commission's plate for these coming 2 years, and that's to advance the competitiveness of the Latino workforce and businesses. Do you think right now that small business owners and workers are at a competitive disadvantage here in Massachusetts?
Yes, especially the Latino businesses. They lack access to capital to grow their business. And by capital, I mean access to affordable loans, affordable funds to be able to grow their business or start a business, and also access to the knowledge and the technical assistance. And that's where my expertise comes from. I work for the Small Business Development Center, and that technical assistance is what we offer for free to all small businesses in Massachusetts. And so what I find is that many of our Latino business owners didn't know about our services. They didn't know that we were offering that free technical assistance. They don't know about the Community Development Funds institution, the CDFIs, that provide access to capital in disadvantaged and low-income communities. So, I mean, I think it's a task for us to make sure that people know and understand what resources are available to them. So that was a conversation, right? There are resources available currently that not many folks are taking advantage of. But on the other hand, there's just not enough capital out there that's being deployed to these small business communities.
What gets in the way for people, for those small business owners? What gets in the way of them getting their hands on that money?
Well, part of it is their own financial well-being. Like if you think about, being healthy and going to the doctor. So people don't quite understand yet how to manage a budget. Sometimes their credit scores are very low. They got into credit issues when they were younger. They're trying to get out of that. So credit counseling is needed. When you go to a bank, no one's going to give you a loan if your credit score is less than 600, and we have a lot of folks that are going through that right now. And especially if you don't own a home, if you're renting a home, if you don't own a vehicle, there's so many other aspects that come into that, and people of lower income and disadvantaged communities don't have access to those things.
Another area that we found was also the lack of information and the lack of accessing the information to be able to move on. So I think that
Bilingually, right?
Yeah.
Yes, access to a technical assistant in Spanish or in other languages is really clear cut as well, because, I mean, it kind of goes hand in hand. You go through the educational system to kind of get help to learn English as a second language proficiently, so then you can access all of the resources that are available in community in English.
Right.
And so in the meantime, though, I think there needs to be a transition, there needs to be an offer in Spanish as well to folks.
which guided us to priority number 3.
That's right.
Which is making this state or making Massachusetts more immigrant friendly, right? More welcome to immigrants. So what did the commission hear, either in those listening sessions across the state or here locally, that prompted you to include that piece of information?
I think our Commonwealth has been very blessed. There's a lot of Latinos in Massachusetts who have contributed to the state and who has different aspirations and challenges at the same time. So when the immigration topic came about, we talked about families, for example, in the school district, families who have been afraid of being in the schools because they feel that they're going to be reported. They feel that they're going to have to abandon their families, that the families are going to be separated, and it creates an anxiety to the children nowadays that it's just not something good to be working with. And I think that the governor has the best interests in mind and want to help with that component, and we're very thrilled that that's happening.
Also, in regards to workforce development, we talked a lot about the licensing issue with having reciprocal licensing.
Meaning
rights.
if you're a nurse maybe in Puerto Rico, you move here, and you're no longer, your qualifications as a nurse may not apply here, right?
They're not accepted
Yeah.
you're not accepted as a licensed healthcare professional here, even though you have your licensing in Puerto Rico. So those one of the things that we advise the secretaries and the board, of the medical board to look at.
Yeah. In terms of how the commission narrowed its area of focus to these 3 items, how did that come about?
A lot of discussions.
A lot of discussions. There was 6 listening sessions across the state. We have 4 round tables with people, professionals in the field.
That advised us on what matters in each of the areas.
And so, in between the 400 comments that we got around the sessions, these were the topics that you heard the most affecting the Latinos in order for them to be more successful in the Commonwealth.
And now moving forward, you have 2 years to sort of act on these 3 very big issues. Is that enough time to make headway?
In 2 years, we're going to come up with another set of recommendations. So which will address the other issues that we didn't get to address now or
Because
recommend
each of you
them.
serves a 4-year term.
That's correct. That's correct. But between now and then, it is our hope we've worked with the secretariats, housing and economic development and the healthcare and all of those. It's with their team. All of these recommendations are with their team. They had input in this as well. So we're hoping that they'll get back to us with the things that they're working on and basically a progress report.